Welcome back. So health workers at the Dora Nginza Hospital in Gqeberha took to the streets protesting over unpaid overtime dating back to last September. But this isn't an isolated issue across the Nelson Mandela Bay, from chronic understaffing to crumbling facilities to healthcare systems. The healthcare system, is said to be failing both workers and communities. Our reporter Sipha Kema visited 3 failing hospitals: Dora Nginza Hospital, José Pearson TB Hospital, and a Colchester clinic, to unpack the issues.
Overtime payments are just one issue. In many facilities, healthcare workers face unbearable conditions with collapsing infrastructure and limited resources. At Colchester clinic outside Gqeberha, the situation is dire. Nurses say the clinic is barely functional.
We don't have equipment to work with. We haven't got BP machines. We don't know where to complain to. We are just eating up all the nonsense that the people give us, because they're complaining to us, and then we get the words from the patients. Then the nurses don't the nurses give us a duty to do. Tell the community we won't be coming, or they're only taking 20 people this week. Then we get all of that ugly words.
At José Pearson TB Hospital, healthcare workers and unions say water shortages are a major crisis. One shop steward claims he was transferred after raising concerns about the hospital's poor conditions. The Eastern Cape Department of Health denies the allegations regarding the water issues.
The hospital does have water. The hospital has 4 Jojo tanks which are filled to the brim as we speak. The only thing that happened was that on Thursday and Wednesday last week, the municipality was maintaining pipes nearby the hospital. That then interrupted the supply of water.
For the communities relying on these facilities, the collapsing system is unbearable. Elmarie Bernard, a Colchester resident, says poor service has made accessing healthcare a nightmare.
Number one, they're terribly rude. They are extremely rude. Don't try to take them on. Don't try to ask a question even. I've had incidences with my son, which got epileptic seizures. Medication was packed, 48 tablets per package, but he needed 120. He needed 4 per day. So I've tried to go back and then please ask them, can I get some more medication? They will give me, but it's expired. I had to go to Blue Water Bay Clinic Care with his clinic file and ask them, there is a script in there, can I buy the medication?
A recent protest at Dora Nginza left patients vulnerable, with some reporting that the hospital kitchen was shut. Nursing union Denosa says these conditions stem from provincial departments' failures.
The patients were not treated in the manner and the dignity that they're supposed to be treated. But, however, it is not the fault of the members or the workers, it is the fault of the department. Because even the overtime, we do not want overtime as workers, but due to the gross shortage of the workers, the department that do not want to employ workers, it results to these protests.
Unions like NPSAL are now calling for the health department to be placed under administration, saying the problem goes beyond the Nelson Mandela Bay.
We've been saying as NAPSO, this is a provincial problem. It cuts across. It is not only a challenge that is sitting in one region. Hence, we are even now saying the Department of Health must just be under administration, because it has continuously failed over many years.
The Department of Health admits its finances are stretched. However, a team has been sent to stabilize the Metro's healthcare system.
The department is well aware of what is happening in the Metro. Hence, the department has then deployed a team to the Metro to ensure that there is stability in the Metro. Definitely, there are long-term and short-term plans to deal with the issues of staff shortages, unsafe working conditions, and poor management.
The department says facilities like the dilapidated Colchester clinic, which will now cost the department 3 million rands to refurbish, will be difficult given the budget constraints. For Newzroom Afrika on Channel 405, I'm Sipha Kema in the Nelson Mandela Bay Metro.